Most of the injuries associated with rugby are soft tissue injuries or injuries to the muscles, ligaments and tendons, such as ligament sprains, muscle strains, bumps and bruises. The signs and symptoms are easy to recognize. Pain is the most effective way of determining the location of the injury. Swelling and discoloration only develop at a later stage. These injuries should therefore be treated immediately using the right procedure.
The R in RICE stands for rest. The logic behind rest and removal from activity and protecting the player and the injury during the acute phase is very sound. This minimizes pain and bleeding, prevents further injury and improves the comfort of the player. Although not based on scientific evidence, most experts agree that this period should last between 1 to 3 days. I stands for ice. The use of ice dates back many years and should be applied to the injured body part as soon as possible. This reduces pain, minimizes bleeding and restricts blood flow to the injured area and thereby limits swelling. It appears from the literature that initially intermittent cycles of 10 to 20 minute application followed by 10 minutes at room temperature followed directly by another 10 to 20 minute application every 2 to 4 hours seems to be the most effective and practical treatment protocol. The frequency of the application can be reduced over the next 24 to 48 hours. C stands for compression. Although no scientific evidence exists with respect to the duration, intensity and frequency of compression, best practice practical guidelines are provided. A compression bandage will limit the amount of bleeding and the swelling in the injured body part by compressing the space. When you apply a bandage on a soft tissue injury, it's important, however, to use a stretch bandage. An injured part often swells after the game, and if the bandage does not allow to accommodate this to some extent, it can cause other problems. Scientific evidence supports that compression applied together with your ice application is much better than ice application alone. However, your compression seems to be the most valuable part of the treatment protocol and should be prioritized. When using compression, always apply the bandage starting below the injured area and apply progressive layers towards the injured part and going beyond. Never apply the bandage too tightly as this can induce pain. E for elevation. Although scientific studies are lacking, this is widely used as forms part of the current best practice treatment protocols. Try and raise the injured body part above the level of the heart for the upper limb injury and above the level of the pelvis for a lower limb injury for as long as possible during the first 48 hours following injury. This can be done by placing pillows underneath the injured limb. This reduces the effects of gravity and subsequent blood flow to the injured body part and assists in draining fluids from the injured limb. D for diagnosis. This is the most important. Consult a medical professional as soon as possible to determine an accurate diagnosis of your injury so that the appropriate treatment and rehabilitation process can begin.
D also stands for drugs or pharmacological agents used by physicians in treating acutely injured players. For more on this topic, go to the website at www.BokSmart.com. It is unfortunate that many players and clinicians have favorite treatments, which may incorporate traditional or historical beliefs and myths related to the healing of an injury. However, many of these are not evidence-based and may in fact extend the injury or delay healing and recovery after an injury. These interventions should be avoided in the initial 48 to 72 hours. One way of doing this is to apply the no harm principle. In the immediate 48 hours following the injury, avoid any heat, alcohol, running, or massage to the injured body part.
Heat and alcohol cause the blood vessels to dilate or open up and increases the amount of bleeding in the injured area. Running, exercising, or massaging the injured body part also stimulates an increased blood flow to the injured area and can lead to tissue necrosis or tissue death. This increased bleeding, swelling, and necrosis in the injured area is detrimental to both the healing process and recovery from injury.